For this project, we interviewed Dr. Eugene Sprague. Dr. Sprague currently works here at UTSA as a professor and advisor in the biology department. He used to work for the University of Texas Health Science Center as a research scientist and tenured professor. He taught pathology, radiology, and cardiology, as well as researching several cardiopathy problems, creating new devices, and earning himself 19 patents. He has a bachelor's degree in biology, a master's degree in reproductive physiology, and a PhD in pharmacology from the University of Texas at Health Science. The first step to becoming a medical laboratory scientist is to obtain a bachelor's degree with a 2.75 GPA or higher in a relevant health science related field, such as biology. The next step is to gain experience in clinical laboratory settings by interning or volunteering with various hospitals and clinics. The American Medical Association recommends to be a competitive applicant to have over 100 volunteer hours. The next step is to take and pass the GRE, and then you apply to a medical school for a Master's of Science program with Medical Laboratory Sciences. Once there and you have completed the training and the courses, you must have 1 year of clinical laboratory experience. Then you take the test and get certified by the American Society for Clinical Pathology.
Hi, my name is Jade, and this is your typical day as a medical lab technician.
Medical lab technicians usually run routine or automated tests. They can operate equipment just like cell counters or microscopes.
They analyze bodily fluids and are also in charge of recording their findings to the patient's medical record.
Running a research lab is science and business, and your hours are typically long, so it does take a lot of dedication. However, as Dr. Sprague puts it, the results of presenting your ideas and most importantly helping people is a very rewarding experience.
Medical laboratory scientists can work in many different environments, such as hospitals, clinics, public health or forensic laboratories, veterinary clinics, and even research institutions. These labs inside these environments are typically ran 24 hours a day for 7 days a week. So depending on the setting that the scientist is working in, they will usually work full-time at 40 hours a week, but most of the time go above that because of how important and demanding their field is. That being said, not only is the workload a lot for these scientists, but also the work environment is dangerous because all the different types of chemicals and specimens that these scientists work with. The average yearly pay for a medical laboratory scientist in San Antonio is around $95,000. And while interviewing Dr. Sprague, he really emphasized the need for creativity in his field in order to stay competitive with the other researchers. He also emphasized needing communication skills since you are working with sides and other physicians most of the time, as well as data analysis skills and critical thinking skills.
When talking about recommendations for first-year students, Dr. Sprague gave us 4 pillars to follow, and he believes that these 4 pillars help students follow a structured pathway. The first pillar he gives is to know what course you have to take according to your major. The second pillar he talks about is to know what you have to do in those courses and make sure that you keep up with your classwork and project. The third pillar he talks about is to join extracurricular activities, whether it be volunteer or paid, and he believes that this pillar builds up leadership for the future and your future endeavors. The fourth and final pillar that he talked about with us was know what to research. He says that medical lab researching is really competitive and a lot of researches become really repetitive. So for you to know what to research and make it a valuable asset to medical research is really important since the field is very competitive.
Some other relevant information about Dr. Sprague is that he was drafted in the Vietnam War and was assigned to the Air Force. In the Air Force, he was trained as a medical lab technician and worked his first year in a hospital as a phlebotomist, where he did rounds on patients and took their blood work. Something else Dr. Sprague mentioned was a 3+2 Medical Lab Science Early Acceptance Program. This program is a partnership between UTSA and UT Health, where students spend 3 years at UTSA earning their bachelor's degree, and then spend 2 years at UT Health to earn their master's in medical lab science. Overall, this program is a great resource that helps students prepare for a career as a medical lab scientist.